Hello and welcome to Sex RX. I'm Dr. Manny. Listen up, guys. It turns out there's a shot that can help boost your sex drive, performance, and function. It's called the P shot. Joining me now is Dr. George Liakeas. He's the medical director of Smooth Synergy Spa in New York City and is giving the shot to his patients. Thank you for coming. All right. This has to do a lot with erectile dysfunction.
Yes.
How big is that problem for men today?
Well, for one thing, it's much bigger than most people would think, mostly because it's an uncomfortable topic. People don't talk about it unless they're asked. And at the end of the day, it appears that up to 50% of people over the age at least of 40, but even younger, will experience some sort of sexual health dysfunction.
And this epidemic of erectile dysfunction, you think, is attributable to medical conditions that have creeped up, like obesity, diabetes, and all those things?
There's no question. It's a complicated topic. Let's put it this way. Years ago, we used to think it was all up in your brain. We used to think that anybody who had a problem could get over it with counseling and thinking of things through, etc. And now we know that's not the case. Definitely diabetes and prostate cancer and the surgeries, circulatory problems, coronary artery disease, but even medicines like antidepressants, even medicines we take for hair.
All right, so we had the Viagras, we have all these things. Now we have something called the P shot. What is it?
Right, the P shot is actually a patented protocol that was invented by Dr. Charles Runnels. The Priapus shot, Priapus is the god of fertility in the ancient Greek culture. The Priapus shot is utilizing an old-fashioned technique, or at least a procedure that's been done for years in other specialties like orthopedics, dentists, ophthalmologists, and now even dermatologists. It uses platelet-rich plasma to rejuvenate, restore, and revitalize certain organs, in this case, the penis, to restore the cells and the tissue as it was perhaps when someone was younger.
All right, so let me kind of say, so, I'm in my late 50s, I have erectile dysfunction, the pills give me side effects, I want to rejuvenate my penis.
Right.
I come to you. You extract my platelet-rich plasma, you put it through the centrifuge, just similar to what athletes do with their tendons. You take my penis and you inject it with this rich plasma all over the place. And over time, my penis builds up the tissue so that I can get a more effective erection.
It's exactly that.
Bingo. How effective is it?
The Dr. Runnels and the group that's been in place doing these procedures, like myself, we have been gathering data as well as the data that's been used in animals, not for the P shot, but for similar things. It appears that over 90% of men that have done the procedure have instant and then long-lasting benefits, and up to 20% of them will even have a significant, recognizable or noticeable growth in length and girth.
Okay, so we're talking about an anatomical alteration. How many shots do I need before I change the shape of my penis?
Right. The procedure is done one time, and then again, you can do it in 3 months later to get a boost. But even after the first treatment, you'll notice a difference. The procedure itself is 5 shots.
But you do it over a period of what, a couple of days?
No, 5 shots in one sitting.
5 shots in one sitting.
Very quick and
easy.
All right.
So you alter the anatomy a little bit. How about the function? Do you improve erectile dysfunction after you get the P shot?
Well, that's what it was primarily for. The anatomy, the improvement in the length and girth, while exciting and a big selling point for many people that are interested. And by the way, it's not just length and girth. Some people have scarring or curvature, and it has recognized improvements in that aspect as well. But primarily, PRP is supposed to increase vascularization, improve the collagen cells. It's basically fertilizer for your body's own stem cells.
It's a facelift for your penis.
Correct. So there's an improvement in appearance, but sensitivity is the big one.
A common question, 5 shots all at once, does it hurt?
We use a numbing technique that really renders it painless, and that I can attest to.
Now, all of these results and all of this rejuvenation, is it approved by the FDA, or is this something that people are doing off
Off-label, right.
Off-label.
The fact is, this is a blood product technique. It's not really under regulatory guidelines by the FDA. It's not a drug.
Right. So this is something that you guys came up and you're making some results, you're collecting the data, but it's not been sanctioned by the FDA.
Well, the same way it's not sanctioned by the FDA when the orthopedists use it.
Right, I get it.
Yeah, it's not in that category.
Okay.
But it is the same.
And once you have
technique.
once you have the facelift and the shape and all of that change, how long does it last? Is it a lifelong change?
Well, because there is neovascularization, because it's improving the cells that are in your body, it is possible that the change could be permanent. But the studies that we've been collecting, which are now going back a few years, seem to show that people are happy for about a year, maybe even up to 16 to 18 months.
And then they have to come up with another facelift.
And then they probably do it again, yes.
All right. How expensive is it?
It's $1,900, at least in our center, and probably that's about the price it is elsewhere, because we didn't make up that price. It's an expensive procedure because the machine that we use to centrifuge is not just a regular doctor's centrifuge, and that's the key.
And how do patients find out? In other words, how do I wake up in the morning and say, you know what, it's time for get my penis a facelift?
Right.
How do I find? I mean, how do I go from that point to your center? Are you getting referrals from urologists? Are you getting referrals from dermatologists? How do you get the patients to go and?
Yes, usually there are referrals from urologists because a patient will end up in their office.
Right.
But more and more, we're finding people that have found us online because they've heard of the P-shot.
Okay, last question. Are there any contraindications? In other words, are there patients that do not qualify for this type of procedure?
The answer to that is definitely not. It can be done to anyone. It can be done with any condition. It's your blood. You can use it in conjunction with some of the other techniques that are out there, including medicines. And because it's your blood, there's no allergic reactions, there's no side effects. It's an injection with a very small needle. Of course, there could be a bruise that's temporary.
And what's the recovery time?
There's no downtime. You can leave and be active.
So as soon as I have the facelift, I can go.
You can go back to work. You could be sexually active, and no concerns.
All right. So where can people get more information on the P-shot?
You can Google the Priapus shot or the P-shot, or you can go to www.smoothsynergy.com. That's my office, and we'll be happy to answer any more questions.
All right. Well, thank you for coming.
Thank you.
And if you have any health questions, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.